Britain's homeless or poorly housed often have poor health. In Bradford, Horton Housing and Bevan Healthcare, supported by several agencies, have made real progress bringing health and social care together to help them. When a former chef collapsed outside the hostel where he'd been staying, he was found to have internal bleeding. Rushed to Bradford Royal Infirmary's A&E, Nick was stabilised and told to expect an operation, but there'd be a delay of several weeks. In many hospitals, patients like Nick would be kept in, blocking a bed. But in Bradford, a scheme called Pathway tracks vulnerable patients, with many offered supported temporary accommodation nearby. Nick's lucky and can be safely discharged. Bevan Healthcare's nurse Helen Phelan oversees the discharge before Horton Housing manager Sarah Jones briefs him on his new home. Nick is moving to BRICSS, Bradford Respite and Intermediate Care Support Services, a former mill building that's been converted. There are 14 ensuite rooms with mini kitchens and a shared cooking and eating area downstairs. With support staff permanently on hand and regular visits from clinicians, BRICSS has already proved a success. But getting it open on time was a challenge. Horton Housing already had the building, but it wasn't DDA certified and the government grant was time limited.
We were advised of our grant being successful something in October, and we had to have the building ready for January, and then there was 3 months revenue up until the end of March. So from getting a building that we had but wasn't fit for purpose to get that ready by January and then to run the project for 3 months, that was no mean feat.
To be compliant, the building needed a lift.
The building is in the Gartland conservation area, so we designed a contemporary add-on that sits, in our view, comfortably with the Victorian style of the existing mill. Structurally, it was quite a complex design as well, where we had to effectively put a new steel frame up to support the lift car that then would serve all of the floors.
To build the lift shaft with a lift pit, we had to actually underpin the existing foundations, that is, dig down at the side of the existing foundations. So that was really the trickiest bit of the whole job, really, was getting those foundations in.
If the building was on track, preparing Horton staff was a separate challenge. Many had worked with people who were homeless, both at Horton's Edmund Street Day Shelter and through other Horton services. Finding patients with housing needs in A&E or the wards demanded a new way of working. Nurse Helen Phelan acts as the eyes and ears of Horton, although actually funded by Bevan as part of the Pathway project. Helen liaises with clinical staff, then talks to patients who might need extra support, be it with housing or drugs or other issues. Then it's over to the team at Horton.
I will interview clients or patients, as they're known at the hospital, for potentially coming into the accommodation scheme. I have 2 members of staff that will work with those clients once they're here, intensely in the sort of period of time, which is 6 to 8 weeks.
In terms of understanding the health dynamics and the priorities and protocols that health services have, it worked very well because with our partners in that respect, they were able to advise and assist us in understanding that regime.
By March, building work was complete. The lift tower had been installed and the rooms were ready. BRICSS began taking clients. They loved the place.
Without BRICSS, I could have been on streets, I could have been anywhere, I could have probably died of liver failure.
If it were up to me, I'd stop here until the end of time, and you know what I mean? I mean, like, I up there, I love my home and stuff, you know. I don't want to leave, but have to, rules.
When you need help, I thought I wouldn't get any help, but I have, and it's brilliant, and I can't thank them enough, really.
Bevan Healthcare clinicians hold surgeries in Horton's day shelter and run a street medicine service from soup kitchens or hostels. They've bought a motorhome from which to offer mobile consultations. All services can refer patients to BRICSS, from where they will either step up into treatment in hospital or step down to supported living in the community. Horton Housing and Bevan Healthcare are the main agencies in all of this, but they could not have created such a wide-reaching and effective service without other stakeholders in the team.
It fit in with our strategic objectives, really, and it was really good in terms of that. In fact, we funded it, but we had matched funding through the local authority. So that effectively started us working together through health and social services as a wrapped service.
I've worked with both Horton and Bevan for a number of years, so I know them really well. And I was more than happy to give them a reference for this work, bearing in mind the need around homelessness in Bradford.
It is exactly what we should be doing, working together, providing integrated services, particularly targeted at people who are the most vulnerable.
The Pathway Service, the Street Medicine Team and BRICSS have delivered huge savings to the public purse.
For every pound that was invested in BRICSS, the value of the benefits would be between £2 to £4. And that range depends on the different client characteristics. I think that Bradford is probably in leading light in developing this trio of services, and the fact that there are 3 services focusing on different but equally very important aspects of the healthcare of people who are homeless or in vulnerable housing situations is very important.
As a model, we've found out that it works very well in terms of delivering a better holistic services to vulnerable people. I'm sure that we could replicate that type of service in other areas for other client groups.
Horton Housing's new BRICSS unit has been praised for bringing health and social care together, saving public money and reaching people on the margins of society. In April 2015, it was shortlisted for a UK National Housing Award for meeting specialist housing needs.